Hello everybody, my name is Tatiana Ugritsova and I'm here to give you a short presentation on tele-assessments. So I'm part of a team of researchers and also trainees who are looking to optimize and to standardize telerehabilitation practices. So we have a group of us working in the field of pediatrics, and this is composed of myself, Dr. Annette Maimer, and an OT student from McGill University, Galil Osman. And we have another team that is working in the same field, but in the adults side. And this is Dr. Zachary Boychuk and Dr. Sarah Ahmed. So just to put you in context, we have met with clinicians on several occasions now over the past year. And first, we got to know each other, we shared our experiences, and we've heard some of your training needs and some of the challenges that clinicians have experienced so far with telerehabilitation. And then we proceeded to working towards effective use of telerehabilitation. So to that effect, we have presented already 3 webinars that were live on the use of tele-interventions in childhood disability. And now this webinar is actually being recorded and it can be watched by clinicians asynchronously. And you also have supporting information in form of handouts that are discipline specific. So I will let you know a little bit more how it works later in the presentation. And then we're hoping to see you very soon for our part 3, which is the co-creation of knowledge translation tools. And I will explain at the end of this presentation more about this meeting that we really hope to see you all attend. So let's proceed. Our questions for tele-assessments were as follows. So we were interested to see what tele-assessments exist in the field of rehabilitation for children and youth with disabilities and their families. And of course, we were interested what those tele-assessments are comprised of in terms of their rehabilitational, the professional in rehabilitation, whether it's a physiotherapist, occupational therapist, a speech language pathologist, a neuropsychologist, audiologist, or a vision specialist that is doing this particular tele-assessment. We were also interested to see the focus of the assessment itself. So does it look at to evaluate behavior, speech and language abilities, or signs and symptoms of a particular diagnosis, such as autism spectrum disorder, or motor abilities, visual acuity, hearing acuity. So we really wanted to see what was the focus of the tele-assessment. And we were interested to see also how it is delivered. Is it through video conferencing, through calls? Are there any specific software that were used? So this is the data that we also extracted from the literature. And lastly, we actually wanted to determine how valid, reliable, sensitive, and specific those assessments are. And another thing that we were interested in is if a face-to-face assessment was also conducted, what is the agreement between the tele-assessment versus the face-to-face version? So how comparable they are. So this was a very important information, of course, that we tried to extract when it was there. So in order to answer to those questions, we have completed the systematic literature review using those various standard steps that you can see on the screen. And we have come down to 55 intervention studies that we have already reviewed together with you in the previous 3 webinars, and 16 assessment studies that we're actually going to look at today, but in a slightly different format. So we have 6 different rehabilitation specialties that we have classified our studies in, and those include speech language pathology, audiology, psychology, interdisciplinary team, vision, and physiotherapy. So just to give you an overview of how many studies were published in each discipline and where they came from. So we have 6 studies in this speech language pathology discipline, 5 studies in audiology, 2 studies in neuropsychology, 1 for the multidisciplinary team, 1 in vision, and 1 in physiotherapy. And as you can see, the majority really came from the States and also Australia. We do have 1 study from Canada, 1 from Taiwan, and 1 from South Africa. So in this one slide, I'm going to summarize the findings of those studies by looking at the population, the target in terms of the population group, the diagnostic group, the focus of the assessment, so what it was looking to assess, whether there was a face-to-face comparison that was made, and if a face-to-face comparison was conducted, then what was the agreement between the tele-assessment and the face-to-face? So we're gonna first look at the speech-language pathology studies. So we have 6 of them, and they have included anywhere from 13 to 35 children aged 4 to 18 years old. 50% of the studies included children with autism spectrum disorder, and the focus was to assess speech and language abilities in 83.3% of the studies and dysphagia in 16.6% of the studies. We have close to 67% of the studies that did a comparison with the face-to-face assessment, and for those that did, they have found excellent agreement between the tele-assessment and the face-to-face assessment. So this is wonderful news. For the audiology studies, we have 5 of them, and they included anywhere from 4 to 6,424 children aged 0 to 6 years old. In 60% of the studies, those children had hearing loss, and for all of the studies included in this review, the focus was to assess hearing acuity. Only 20% of the included studies in this section on audiology conducted a face-to-face comparison, and for studies that did that, they have found excellent agreement between the tele-assessment and the face-to-face assessment. We will proceed to neurophysiology. Neuropsychology, So we have 2 studies that included 17 and 20 individuals aged 0.3 to 4 years old. 50% of those studies included children with autism spectrum disorder, and they looked at assessing developmental status and functioning, as well as social and communication and behavior in another study. Only one of those studies, so 50%, used a face-to-face comparison, and the one that did found excellent agreement between the tele-assessment and the face-to-face assessment. The multidisciplinary team included a study with 17 participants aged 2.5 to 6 years old. All of them had suspected autism spectrum disorder, and the focus, in fact, was to assess for signs and symptoms of autism spectrum disorder. This particular study did conduct a face-to-face comparison and has found excellent agreement between the tele-assessment and the face-to-face assessment. The vision study included 203 individuals aged 3.4 to 12 years old with vision loss, and they looked at assessing visual acuity. This study, however, did not perform a face-to-face comparison, so we cannot comment on the agreement of the study. However, clinicians as well as patients and families have reported high satisfaction with the use of the tele-assessment for visual acuity. And lastly, the physiotherapy study included 59 children aged 5 to 11 years old with motor difficulties, and the focus of the assessment was to assess motor performance, and this study had a comparison that was done face-to-face and has found excellent agreement between the 2 approaches of tele-assessment versus the face-to-face study. So now, given that we have those 6 disciplines and they're quite specific, what we designed is that we have developed very detailed handouts that are discipline specific, and those handouts were forwarded to you by your clinical coordinators. And in those handouts, you're going to see much more information about the different studies, about the platform that they've used, or the software that they've used, or the particular assessments that they've used. So this is something that you can really see and read more in detail and decide if you would like to implement this in your own clinical practice. So I'll show you an example of such a handout for speech and language pathology. So we can see here the population of interest. So the target is cerebral palsy and dysphagia. We see information about the sample, that there were 19 children aged 6.9 to 17.5 years old. The assessment that was completed was a dysphagia disorder survey, and this was the focus of this assessment, including orienting abilities, the reception, containment, oral transport, chewing, oropharyngeal swallow, and post-swallow abilities. The equipment that it involved had a video camera, a tripod, a PC, and a monitor. They've used a specific platform, which is the QuickTime Player recording, and the results where they found moderate to excellent inter-rater agreement between the face-to-face and the tele-assessment version. There are also sometimes pictures that will appear in the handout, either of the tables that would show you particular results of interest or of the setup. And you also have here a link to the article itself that you can click on this link and access either the abstract or the full publication if it's open access. So this is what you received, and you can go and just open the handout that is discipline appropriate for you and review all of those results. So now what I would like to share with you is that our part 3, which is the co-creation of knowledge translation tools, is going to happen very soon, in a couple of weeks, and you will receive a notification from your clinical coordinators about this particular webinar. So we really hope to see you in big numbers attending this particular webinar, because what we are trying to do is to design and to develop online knowledge translation tools and resources for you as clinicians, but also for patients and families. And we really need your feedback on what you would like to see in those tools and how you would like to see them being designed so that they're really suitable, relevant, and understandable to you. So really the success of those online knowledge translation tools depends on your feedback. So it's really important that you attend this next webinar that we're going to have to help us in this journey. So I thank you very much. You can always reach out to me if you have any further questions, and I wish you the best in your telerehabilitation practices. Bye-bye.